When I tore my Achilles tendon, basically I was totally impaired. Walking was a challenge. Going up a flight of stairs was a challenge. I had a walking boot. There was about a week period of time from when I first injured it to when I had the surgery. So during that week, let's just say that functionally I was probably at about 10%.
I had an awful lot of pain in my right ankle. It was bone on bone. It was very painful, probably even to walk a block or two. So I got to a point where I had to seek out an orthopedic surgeon to talk about maybe ankle replacement.
I tore the tendon on the outside of my ankle, known as the peroneus brevis, and it just happened playing soccer. I was just playing defense, and it just tore as someone was coming at me. We did physical therapy for a little bit and it just didn't work. So that's when we went to see an orthopedic foot and ankle surgeon.
I made an appointment to see an orthopedic foot and ankle specialist, and when I went in, I was hoping to find out what was causing the pain in my foot. What I learned was that I had a Morton's neuroma, which apparently is an irritated, swollen nerve that runs generally under the 3rd and 4th toes. And if left untreated, it can cause permanent damage to the nerve. And we then together discussed the various options I could move forward with in solving my problem.
The value that they bring in terms of the direction and the processes that they put in place for you to be able to return back to normalcy is invaluable.
So what would I tell someone that's considering ankle replacement? Consider the quality of their life. If they're having trouble getting around, I had trouble walking 1 or 2 blocks. And when I walked a couple blocks, I had to sit down because of the pain. And considering now 4 months later after the surgery and how I get around and how the pain's gone, I would say consider that. And for a few days of discomfort, basically all it is discomfort, and maybe a month or 2 of rehab, it'll make quite a difference in the quality of your life.
It was the best. It was literally like probably one of the best days of my life. It was so nice to be running around with teammates and just playing the game I love.
I have had no problems since I had my cortisone injection. I can do everything I did before, and I'm not going to climb Mount Everest just yet, but I have gone back to dancing, walking, I work out routinely, and I have full use of my foot again, and I'm very happy about that.